A total knee replacement, or arthroplasty, is a surgical procedure to remove damaged portions of your knee joint and replace them with plastic and metal implants. The knee joint is formed by the femur or thigh bone, the tibia or shin bone, and the patella or kneecap. The end of each bone is covered with a layer of smooth cartilage that cushions and protects the bones during movement. To begin the procedure, your surgeon makes an incision down the front of your knee. The first part of your knee that is exposed is your patella or kneecap. Your surgeon rotates the patella to the side. Damaged bone and cartilage at the end of your femur is carefully measured and cut away. Then your surgeon attaches the metal femoral component to the end of your femur. Next, your surgeon removes damaged bone and cartilage at the top of the tibia, and the bone is measured and shaped to fit the tibial components. A metal tray is fit against the cut top of the tibia and secured into place. A plastic insert is snapped into the tibial tray. The femoral component slides on this tray as you bend and flex your knee. Before returning your patella to its normal position, your surgeon may remove part of the bone and fit it with a plastic piece to ensure a proper fit with the rest of your implant. Your surgeon will ensure correct balance, alignment, position, and movement of your new knee. To finish the procedure, your surgeon will close the incision with stitches or staples. Knee replacement can significantly reduce pain and improve function. Like all surgeries, risks and complications are possible. Your doctor will explain these to you before surgery.